I think we've had three very interesting, insightful, challenging presentations, and I'd like to open the floor for questions, clarifications, and asking us to think how we're really going to move forward on effectively on these points. So at the end of the day is really when we would be looking in general at how we focus our activities. But any questions?
I have a question.
Lee?
I have a question of Tanny Adams. You suggested that the way we think about all of this is too linear, too segmented, and that we have to think differently. If we are convinced to think differently, we run up against the fact that the institutions we are dealing with, that fund us, that evaluate us, that legitimate us, they're not thinking that way. They are thinking linearly. They are thinking in a very siloed way. Have you thought about what we do about these institutions that have to change if they're going to reflect the reality that you've documented on the ground?
Yeah, I think the good news is that everyone realizes that where did you go? There you are. I was like to answer the person disappeared behind the column there. The good news is that I think everyone realizes that it's broken. That what's the way we're looking isn't working. And so, for example, working with AID this summer, I heard no resistance to thinking in a more integral way. They also, folks inside of institutions are also very frustrated. People who are working with goodwill and with their eyes peeled see that they have to work in more integrated ways. So that's the good news. Yes, but everyone, those restrictions do exist. In El Salvador right now, I think people who are wanting to start the conversation with the government of El Salvador are all the people in the social protection agencies, the education ministry, the health ministry, social protection ministries, and they understand they have to think in a more integrated way. How you do that, it depends on the political will of the moment, right? So I think these are conversations that just have to start at every single level. And what's always good is that when you start these conversations, there's always someone who says, yeah, I get it. We've been fighting this, we've been bashing our heads against the wall for a long time on this. So the world's imperfect.
Arturo?
Thank you very much, Tammy, Damien, and Carla for an amazing panel. Very inspirational. And I stopped on this phrase that Carla shared with us, that violence cannot be separated from the effects of colonization. This is 500 years ago. And this is amazing because it seems to perpetuate itself. And she also mentioned this unworkable legal system in the country. And I was thinking of the big elephant in the room in terms of Central America and Mexico. And I keep bringing this topic up. In our last workshop on the means of violence, we discussed guns and ammunition as a major part of the Central American problem, and the trafficking and the illegal trafficking. And I wonder if we should not talk about the social norms that allow this cycle to continue to affect the life course of hundreds of millions of people, not only in Central America, maybe throughout the world. Now that you bring up the UN declarations, on our last panel, we also spoke about 5 or 6 countries who are responsible for the 90% of the illegal arms trade that is affecting our nations in such a way as Damien explained, for example, in Jamaica, or as what we are seeing in our communities throughout Mexico and throughout Central America. So I wanted to ask you if you could comment regarding this issue as a major macro determinant for what is happening in the communities and how this cycle of poverty and violence will continue to perpetuate if we don't address these macro level determinants as nations should. That's my...
I think that was just the walk we needed. Your obligatory constitutional. So now we have fresher heads. Should we start then? Yeah? So I think we're picking up on Arturo's question about arms sales, and as we were talking when we were walking over doing our constitutional exercise. The way I think about the arms issue is it's part of a system of illicit trade that is an invisible motor of every economy. I think what was the numbers I heard about the United States recently, 1/3 of the US economy is illicit, right? And this is, and it's never mapped when all the basic economic measurements never to map the role of the illicit economy in this country, not to speak of countries where, like if you take the case of Guatemala, where 80% of the people work in the informal sector, that 80% of people is outside of the illicit or formal or legal frame. So the arms trade, which is a horrific motor of violence, both in this country, I mean the school shootings, which everyone, we keep running up against the wall on that, and not to speak of what we're seeing in Mexico and Central America. This region particularly is very, very high. Other countries, some countries elsewhere in Latin America, the numbers are not as extreme. But this, because of the effect of the U.S.-driven arms problem, it's a horrific driver. But it's totally linked in with the drug traffickers. I mean, they're often the same institutions that are buying and selling, tied into the U.S. vendors, drug traffickers, human traffickers. It's a circle of that has to be teased out. I'm not sure, I'm not an expert on that, but I think it has to be understood in that framework, and it's a major, major driver. But it's tied into this illicit trade framework is the way I would see it. I don't know if that was helpful.
Glenn?
Good morning. My name is Evelyn Tomaszewski. I'm a member of the forum. Thank you for the panel. It was so much to take in, and I was hearing this common theme of community, individual, the clash sometimes of the expectation. And when you talked about the idea of emphasizing human responsibility over human rights was a very powerful statement to me, and particularly when we've talked and discussed human rights quite a bit. The language has come up in the past 2 days. And I'd like to maybe just frame a question about community. Damien, you spoke about what I heard of almost political mapping used as a way of developing community mapping for control, for power. And I don't know, the question for me is how do you connect with a community that feels that their only way to function is to use violence, is to create sectionality to gain their power, Damien. And then that's juxtaposed to Carla's example of how that very use of power has disrupted community and broken apart community. So Damien, really would like to hear how this collectiveness could be used as a way to engage the youth that you're working with, and how it is that they listen and connect with you.
Okay. Well, basically, we employ a bottom-up approach. The community I spoke about, Tel Aviv, the member of parliament for that particular community had tried several initiatives to try and stop violence, and They could get to the one side of the community, the side where the Don existed, because he had strong political connections and so on, but the 30 youth who had broken away, they couldn't get to them. They were unresponsive. They didn't want to talk to anyone. We took a walk to the community, and it so happens that one of the leaders of the 30 saw me, and he ran out into the road and said, "You don't remember me?" And I said, "No." And he said, "You took me to Montego Bay once on a camp, and we stayed in a hotel, and, you know, it changed my life, and, you know, I came back and told everybody about it and so on." And so that was the inn. And from there, I had to take a lead role now because he would only talk to me. And so we built on that and made the connections, and you know, we started from there. But generally speaking, in our interventions, we tend to ask the community to take the steps. What are the issues affecting you? You know, what are the common threads between the two sides in conflict? How can we move past this? You know, what are the compromises that need to be made? And sometimes it's one champion who leads the cause. In Augustown, the conflict went on for years. This guy came back from prison, his brother died, and he decided that he was gonna kill all his enemies. But we managed to get to him, and his voice made all the difference. What he did was he became a lead in the process, and when we got the ceasefire, he said, "Why stop here? Why not put this out in the media? Why not have a peace agreement?" And so we sat down with them, and they hammered out the peace agreement. You know, what exactly they want to be in it. You know, no gunfires at Christmas, no gunfires at anniversaries, no walking with guns. So they laid out the terms of that peace agreement, and then they said, so we said, what's the next step? And they said, well, we have this agreement amongst ourselves, but the wider community is still fearful. They still see Billy Slaughter as the demon. So why not put this out in front of the community? And so they signed this agreement publicly with other stakeholders, the clergy, the JCF, other stakeholders getting involved to witness that. And once that was done, it transformed the community, because now the community held them ransom to this agreement. The community looked up to them and said, listen, you know, you're breaking the agreement. You guys are not supposed to be coming out on the front line. And so we built on that. And all the dormant organizations, all the organizations that went dormant throughout the period of conflict, they were reawakened because they suddenly now felt a part of this process. And eventually, the peace agreement fell away because now the legitimate organizations, the legitimate local governance organizations, joined up with the Peace Council, and they eventually took it over. And so we saw that transformation take place. So what we try to do is not to fit one model on each community, but as we go to see, to encourage the community as best as possible to take the lead, to take the, you know, to take control of the process. And at the end of the day, what we do want is for the regular citizens to become part of the process. So even the Brownstone community, which I spoke about, which had the significant dip in murders from 2005 to 2015, when Dr. Ward was at Ministry of Health, they had this annual peace march, and that community played a significant role in helping to organize that leg of the march and so on. So it's critical once you get the ceasefire to get as many activities in the community as possible, and also to, while you're doing that, to build on the human development aspect. That's very important, and that's the gang demobilization aspect of our program. How do we now take these 30 guys from Tel Aviv and get them literate? Most of them are illiterate, they can't sign their names. How do we now invest in them for them to move and take the next step? Because if that doesn't happen, the situation isn't going to change. Because you have a guy who's 20 years old and he already has 2 kids on the corner. What is he going to do? Even if he's going to the literacy class, he still needs to give his baby mom some money at the end of the week. So it's managing all of that, investing in the most high-risk youth, getting the wider community involved in the process as much as possible, and encouraging the community to build on the gains that they have made in a sustainable way.
Since I represent the National Institute on Alcohol Abuse and Alcoholism, I'm wondering how alcohol plays into the violence that you see. I agree that, you know, when you don't have a stable state, you have violence, but you also have unregulated alcohol then. You don't have alcohol policies put in place to control it. But, you know, other drugs to some extent, but, you know, alcohol does not cause an individual to become violent, or it's a very rare individual where that will happen. But it plays a role in intimate partner violence and in group violence. And I'm wondering how you can see that. I know that that's a double-edged sword, too, because in my work on alcohol and homelessness, it's a way to blame the homeless person for being homeless. It's their alcohol use, and that's not the intent here. The intent is to just try to understand how alcohol plays in and how we could work from a policy standpoint to change that. So I'm interested in, from each of you, in how that might be important.
Thank you for your question. Yeah, I think in any criminal justice system, it's worsened, exacerbated by alcoholism, substance abuse influences. Our perspective is always from the perspective of tribal sovereignty, tribal self-determination. It comes from the community. And with the work to combat violence against Native women in the U.S., a lot of those tribes want to better their communities. They have their own alcohol prevention programs. A lot of reservations are dry, so alcohol is not sold on the reservations, but that's up to the tribe to determine what, as a community, what they want for their future, whether they want to be dry or have sell liquor or sell beer. And so we've always operated from that perspective, and our view is to empower tribes to create those services and to have the federal government, in honoring their sacred trust responsibility, they always say, which is a government-to-government responsibility relationship premised on the treaty history with tribes, to provide the resources to finance and fund those services for the people. And I think a lot of, I'm not sure of the exact data on that, but I think a lot of Native programs are underfunded. I know Indian Health Services is severely underfunded. So that's one issue that we run up against, not particularly in my work, but generally in the national conversation on Indian issues. The Tribal Nations Conference that's put on by the White House every year will happen next week. And I know that's a big part of the conversation there as well. And I know SAMHSA is doing a lot of work. They have I think they have a tribal subgroup that's addressing these issues as well, because it does impact a lot of, it impacts every family, every Native community, and I think just generally every community in the U.S. So that's my perspective. Thank you.
Well, at the national level, there's no conversation really about the link between alcohol use and violent crime. There is some conversation about the link between alcohol abuse and domestic crime. We have a residential workshop that we invite the most high-risk youth to before they enter our pathway programs. And at that workshop, we have a substance abuse session, and the guys most of them, they say when they drink until they get drunk, that's, unless they get, and if they don't get drunk, then they didn't enjoy the party. It's normal. Alcohol is not seen as getting drunk, getting violent when getting drunk is seen as normal in many of our most volatile communities. I will say though that locally speaking, a lot of the conflicts that lead to bigger conflicts start at parties, or local scene within these communities. The entertainment scene is built around parties. Most of these guys, that's how they generate income. They keep parties, and alcohol is a big part of that. But what happens at these parties is that sometimes, someone gets drunk and then gets in a conflict with someone and sends for his gun, because these parties are held within the community spaces. So, their guns are just next door. Or a lot of rapes take place, gang rapes take place at these events, and then we have an escalation after that, reprisal and so on. But structurally, we haven't begun to think about those connections in the way you describe them as yet.
I can just tell you the case of Guatemala, which I've just been writing up recently, so it's fresh on my mind. There was a good report by McElwain and Moser, whose work you probably know, that mapped out what was going on with alcohol and drug use in Guatemala 2004. And they were reporting that 75 to 90% of men drink, but the problematic drinking is mainly this sort of binge, very extreme sort of binge drinking that's linked to festival days, weekends, paydays, and that in the focus groups they did, which was in Colombia and Guatemala, I think 18 different communities, they were finding that people at that point thought that alcohol was the biggest driver of violence in their experience. And in Guatemala, they mapped it out. It was related. They mapped out in these drawings. People were doing 16 different kinds of violence they associated with, particularly male drinking. Men drink publicly, whereas women drink more in the closet and home, privately, in secret. And people are starting to drink at the age of 10, 12 years old. In gangs and in now this more urbanized new scenarios of chronic violence, the link between alcohol and drugs is significant. And so while alcohol isn't linked, it is linked to violence very directly. Drug use is linked to people are much more afraid of what people do on drugs, robberies and crazier kinds of violence than alcohol drinking. But since this is an Institute of Medicine event, I just thought I'd mention the link between alcohol and just broader, it's not just the link with alcohol, but alcohol situated in a broader array of health problems that is also, I think, one of the characteristics. I think both Carla and Damien have mentioned that the people in these conditions are living with very, very problematic scenarios of health. And what we were documenting now in this new report for Guatemala is we used to think of rural communities as being particularly suffering infectious diseases, malaria, diarrhea, the diseases of poor people, right, that are rural poor people. That's not the case anymore. What we're seeing now is on top of the malarias and the diarrheas, which are also going up because of the effects of climate change. I mean, the incidence of diarrheic diseases over the last 15 years has gone straight up in Guatemala, in areas, in rural areas. But what now we're seeing is that the incidence of hypertension, diabetes, cancers are enormous. I mean, they dwarf the old-fashioned diseases among poor people. Huge levels of 100 to 100,000 cases of cancer, when all the infectious disease, the old-fashioned disease, are maybe 40, 30 of AIDS, 50 coronary heart disease. So,
I just wanted to ask Damien and the group just for a minute to look at the issue of trauma and how we prevent trauma on that. And Damien, I know specifically within Peace Management Initiative, there's a grief counseling unit, and how much that helps with breaking the cycle of violence, and also about a little bit about just what kind of resource allocation do we see, or I'll wrap it up with that, is how little of our, I'll wrap it up afterwards with the issue of resource allocation. But if we could just talk briefly towards the network that you've set up that responds automatically.
Okay, well, we have a trauma response unit, and that unit is primarily targets scenes where violence has occurred in the immediate sense, and that unit aims, essentially their work aims to prevent further reprisals from taking place. So they tend to treat with the likely perpetrators of violence, as well as the those who are the immediate victims, as well as taking another step on treating with the wider community, because that's where we saw a significant gap before, in the sense that a lot of the victim support services focused on only the immediate victim, but forgetting that the wider community, when you have a triple murder, 6 people killed in one community, it affects the wider community, and sometimes responses, you don't know where a reprisal or a response will come from. And so treating with the wider community and the issues that they suffer from exposure to this level of violence has been critical. The Marchpen community we spoke of, several of those youths witness a close family member being killed. And so, it's important, if we're going to have healing and reconciliation, that this sort of work takes place. We had a conference once quickly where there was this guy who killed someone in broad daylight in front of everyone. But there was a truce between the gang, and so no one went to court to testify on him. But he became part of our programs, and we had a conference, and the youth that was killed, his mother was at the workshop, and she saw me, and she broke down, because she was saying, boy, she can't believe that this guy that killed her son, and everybody knows he killed her son, is just here at the conference, walking around like it's nothing. And so, she went into a program and got treatment, and she eventually came around and had conversations with him and forgave him. So that sort of work is a critical component to what we do.
I think that sort of links back to what we were talking about, trauma-informed. I'm hearing it in different ways, and I think we're realizing across many different cultures that while we treat the physical side, there's this very, very important component. And we also know that children within this scenario are even further affected. As we wrap up, because we don't have any more time, but I hope we'll continue our conversations later, is what is really concerning throughout all the different cultures and the programs is how little resources are allocated to this type of work as against what is allocated to the criminal justice system, and how much more effective we could be at this overall building of peace and putting it as a central part of development as we go forward. And our violence prevention work can take on this focus and provide the evidence of how we really need to go forward strategically. I really want to thank all of our panelists and all of you, and I'm sorry one or two you still had questions. I hope we'll get to them a little later. We will continue the conversation.